Thank you, Chair and members of the committee, for the invitation to appear today. My name is Dr. Sanjeev Sockalingam, and I am the Chief Medical Officer, Senior Vice President Education and Senior Scientist at the Center for Addiction and Mental Health, CAMH. CAMH is Canada's largest mental health teaching hospital and one of the world's leading research centers in this field. I also oversee our medical assistance in dying service here at CAMH. Over the past number of years, CAMH has made several submissions to government committees related to medical assistance in dying and mental illness. Our position has been and remains that we are concerned about the expansion of MAID to people whose sole underlying medical condition is mental illness. We want to be clear that this position is not based on the belief that suffering caused by mental illness is not comparable to suffering caused by physical illness. The grievousness of an illness is subjective, and there is no doubt that for some people, mental illness can be grievous and cause physical and psychological suffering. The irremediability of an illness, however, is an objective determination that must be based on the best medical evidence available. And right now, there are currently no established criteria or consensus among psychiatrists for if or when a mental illness should be considered irremediable. That is because there is no evidence in the mental health field at this time to predict the trajectory of any one person's mental illness and to ascertain whether an individual has an irremediable mental illness. And this has been discussed previously. Therefore, any determination that a person has an irremediable mental illness for the purposes of MAID would be inherently subjective and arbitrary. In an attempt to address this problem, the Canadian Psychiatric Association, CPA, recently published initial guidance designed to help MAID assessors identify if a person has an irremediable mental illness. I know this has also been discussed by this committee. We appreciate the CPA's efforts to create clarity around the process of an assessment. However, it does not address our call for creation of guidelines summarizing the evidence gap. Specifically, the guidance document does not offer MAID assessors with evidence-based criteria that could be used to determine the trajectory of a person's mental illness. And the CPA guidance only provides recommendations on a process to follow for assessing a person's mental illness. And this leaves the guidance open to individual interpretation and could put people with mental illness at risk of accessing MAID when they do not actually meet the eligibility criteria. The lack of evidence for how to objectively determine the irremediability of an individual's mental illness is a primary reason we remain concerned about the potential for MAID to be extended to people whose sole underlying condition is mental illness. And this concern is compounded by disagreement amongst physicians on if or how a request for MAID can be differentiated from suicide intent, which is an extremely difficult task for psychiatrists. In fact, a new review of the research literature found no evidence to suggest it is possible to reliably distinguish between the factors underlying a request for MAID and those underlying suicide intent. While the CPA's first edition of MAID clinical guidance has a section on managing suicide risk across all phases of the MAID pathway, it does not provide concrete methods for helping clinicians to determine if the request for MAID is due to acute distress, a symptom of a mental disorder.
Sorry, Dr. Sockalingam, there's an issue, I think, with translation.
Oui, Monsieur le Président. Si le témoin peut juste ralentir un petit peu parce que c'est difficile pour les interprètes de maintenir le rythme.
It's very difficult for the interpreters to follow.
So
would you like me to slow down a little bit?
Yeah, please.
Okay.
We'll give you a few extra seconds at the end.
Okay, thank you. Thank you. Would you like me to repeat any previous statement, the last paragraph? Would that be helpful?
Maybe, how about the last paragraph?
Yeah. So as I was saying, a new review on the research literature found no evidence to suggest it is possible to reliably distinguish between the factors underlying a request for MAID and those underlying suicide intent. And while the CPA's first edition of MAID clinical guidance includes a section on managing suicide risk across all phases of the MAID pathway, it does not provide concrete methods for helping clinicians determine if the request for MAID is due to acute distress, a symptom of a mental disorder, or an enduring desire to die. Finally, but of utmost importance to extending MAID to people whose only medical condition is mental illness, is the state of mental health care in Canada. We've heard mental health has been and continues to be significantly underfunded compared to physical health care in our country, making it difficult for people to get the right care when and where they need it. Demand for care continues to grow while service capacity does not. 1 in 3 Canadians report that their needs for mental health care are unmet or only partially met. In Ontario alone, over the last 4 years, mental health service volumes have increased by 66%. Access to mental health treatment also remains inequitable. That is why investing in mental health care and support should be the priority before any consideration is given to moving ahead with implementing a track to choose MAID. In sum, only when we have evidence-informed, consensus-based criteria for determining the irremediability of a person's mental illness and for distinguishing between a request of MAID and suicide intent, and only when such criteria could be introduced into a well-resourced mental health system would it be possible to offer safe, adequate, and equitable MAID services to people whose sole underlying condition is mental illness. And that is why CAMH recommends that the federal government delay indefinitely the extension of MAID eligibility to people whose sole underlying condition is a mental illness. We are at CAMH are happy to offer expertise to the government, including sharing our recent evidence synthesis on irremediability, suicide, and MAID, and the gaps in the evidence base when available.